Well, February is American Heart Month, and ahead of National Wear Red Day tomorrow, the American Heart Association recently released new guidelines for treating strokes. We're all going to be wearing red tomorrow. Here's a nice red pin that I have, and joining me now is Dr. Saini Harneel, a neurologist at HCA Florida Mercy Hospital. And it's interesting because the American Heart Association recently released these new stroke guidelines. What is the big takeaway there, Doctor?
Yeah, some of the big takeaways are that the American Heart Association updated recently new published guidelines for promoting stroke in adults, treating them more effectively, as well as gave us evidence for tenecteplase, which is a clot-busting medication, to help us abort strokes more effectively.
I was surprised to learn that heart disease is the #1 killer for women. So what should women do to ward off heart disease?
I think the biggest takeaway is to in order to prevent heart disease, is to take prescription medications, have a healthy lifestyle, eat a Mediterranean diet, and as well as go to as many follow-up appointments with your cardiologist.
Yeah, I've read stories about people who have seen people in distress and they took quick action and in effect saved their lives. I'm not a doctor. I see somebody in distress. What do I do?
Yeah, so one of the first symptoms of stroke can be arm weakness, leg weakness, vision loss. We like to use the acronym FAST, which stands for F for facial drooping, arm weakness, speech difficulty, as well as time to call 911.
So, and also I'm surprised to learn that kids are suffering stroke. So parents need to be vigilant about that, right?
Yeah, so some of the big takeaways for identifying stroke in kids is they can present with confusion, headaches, seizures, as well as arm and leg weakness as well. So those are big takeaways to try to identify stroke in kids.
This new push to get people more aware about the issues of heart disease, is it paying off, do you think?
Yes, I believe community awareness, and also the big takeaway for that is in order to empower ourselves, we also need to be at the forefront of recognizing these strokes and the cardiovascular risk disease modifications.
I think it's interesting too. You're here as a neurologist talking about
Yes.
heart disease. The connection, please.
Yeah, so the heart and brain connection is very together. So a lot of strokes occur because of heart disease, and so that's why it's very important to recognize cardiac disease so we can prevent further strokes from happening.
Makes sense. Well, certainly we're on board with the big push to make certain that people stay healthy, and thank you, Doctor, for coming on and making sure that we know what to do.
Yeah, thank you so
Thank
much.
you very
I
much.
appreciate
You've got your red shirt on
Yes,
too.
I've got my red shirt on.
I'll have on red tomorrow.
All right.
Maybe not a shirt, but a tie. All right, for more information about the American Heart Association, visit heart.org.